Marikina and Marcos Highway. And we were working very closely with the personnel of our PNP and our AFP para naman masubukan lahat ng mga situations by which the rapid pass will be used. So again, low traffic, high traffic, nasubukan na namin. Umaga, tanghali at gabi, sinubukan na rin namin. Yung camera po at saka flashlight ng telephone have been tested to work well kahit sa gabi. And so far, kung maayos yung pagka-print ng rapid pass, mabilis yung daloy ng ating mga users. So yun lamang po. I think the solution is very, very self-explanatory. I wanted lang to show you in video kung ano talaga yung actual na usage. So ito yung I will just share this video para makita niyo naman how it really shows in a real situation. So ito yung example. And this is actually a vehicle passing through Marcos Highway. So this is our PNP personnel. Ganun lang ho kabilis, 2 segundo to recognize the pass if it's printed in half a page. Tapos sa loob naman, the passengers also present their pass. So isang verification sa kotse, isang verification para sa passengers. At yung iba naman ho, nilalagay na lang ng mga passengers yung kanilang mga rapid pass sa bintana para naman to accomplish yung goal natin na contactless verification of identities. So, yun lang po. Maraming salamat. Again, we are grateful for the opportunity to help on behalf of everyone in DevCon and DCTX. We feel like this is a worthwhile effort and challenge accepted po, Sec Nograles and Secretary Boy.
All right. Thank you so much, Winston. Before we proceed with the Q&A, are there any reactions pa from our panelists or meron po ba kayong additional feedback or yung experience? Tapos we will soon open the floor for questions kasi marami-rami na po yung mga tanong dito sa queue natin.
Ninya?
Yes po. Yes, Sankoy.
I-relay ko lang yung common questions na natatanggap ko. Halimbawa, mako-cover ba niya yung buong NCR or kailan naman ito pwedeng gamitin sa ibang regions or kung tapos na yung ating mga ECQ, papakinabangan pa din ba ito? Yun. Those are the common questions.
Okay. Thank you very much po. Winston, would you like to address those first?
Yes, so Nina, just before that, I think Secretary Lorenzanas on the chat group, can you please include him on the panel?
Sige, let me check now. Okay. Nawala po siya. He was here earlier and then nawala po siya. Let me.
Nandun sa attendees sa taas.
Okay. Yes. Oo. Nandun siya kanina tapos wala siya ngayon.
Can you make me a host again?
Yes, all right. Okay. We are promoting you two panelists po. Secretary Lorenzana, you will now be joining as a panelist. And then, hang on. Kita na po ba?
Nina, if you can make me a host.
Yep.
Ayan, there.
Okay. I'll do that.
Hello.
Good afternoon. Yes, sir.
Good afternoon po.
Yeah. Oh, bakit hindi ako makita? Wala akong mukha. Hello.
We'll check po yung video.
Wala pa po, sir.
I-on niyo yung video. Oh.
Okay.
Paano kung may on yung video rito? Wala naman ditong
Afternoon, Secdel. Oo, inaayos lang siguro.
Okay. Yeah, I've seen the demonstration. Maganda. I share the concern of Secretary De La Peña. na pwede pa ba itong gamitin sa ibang bagay. I think we should think of other things we can use this after nitong lockdown na ito. Ano? But it is very good. I hope the Philippine National Police will be able to adopt this sa kanilang mga checkpoint even after the ECQ. And this is very useful now kasi nga nagkagulo-gulo tayo ng first week because of sa checkpoints. Wala tayong sistema, yung mga nagdadala ng mga pagkain. This is good. This is good, actually. Hello?
Pa yung,
Sir, thank you po. Thank you po.
Hindi pa nakikita yung ano ni Secdel, yung mukha.
Sandali.
Kaya wala. Wala rin ako. I cannot find the way. Ano eh. I cannot. Ito. Lumabas na. Lumabas na.
Ayan, sir. Ayan na po, sir.
Hello.
Hello.
Ayan po, sir.
Okay. All right. Sige. Okay.
Yes,
Sige, Nines, thank you. I think
okay.
we can take questions now.
Okay na
If
po.
you wanted to ask interactively, raise your hand lang, and I think I can allow you to be a part of the conversation then.
Okay. Maybe we can start with the questions that Secretary De La Peña raised earlier about the coverage of Rapid Pass. Is this NCR or wider?
Sa technology side po, sir, kaya po na i-expand natin around the country. So pinag-isipan na namin yun. Later on din po, kung gusto nating gamitin ang ating technology to help naman with our more granular barangay level quarantine passes, pwede rin po. And we're also exploring any other possibility. Kasi ito talaga, it's really more of the frontliner identification, di ba? So it's really designed kung ano man yung may tulong natin at if ma-identify natin na critical personnel po yung ating frontliner para hindi na po sila maabala at magawa po nila yung trabaho nila. So kahit anumang sitwasyon niya, no? But whether they're helping in the hospital or delivering food, ito pong system na to can extend for that.
Okay, a follow-up question to that, and it's also a frequently asked question. So who exactly are eligible to get the Rapid Pass? And can we be specific? And then will there be lanes dedicated for those who have the pass? Tsaka ano po ba daw yung requirements para mag-apply para dun sa Rapid Pass?
Yeah.
Absec, maybe
Ako? Sige. If you remember, the IATF was giving out accreditation passes, di ba? From PCOO, from DTI, at iba pa mga departments were given the authority to provide accreditation passes to their respective stakeholders. So dito natin muna gagamitin yung Rapid Pass system. So just to make it clear, yung cargo at unhampered, no? Unhampered and unimpeded po ang movement ng mga cargo, any kind of cargo. So para hindi man natin ma-confuse, pag cargo tuloy-tuloy po yan. Wala tayong problema sa cargo. But those over and beyond that, yung sa mga media, yung sa mga sa stakeholders ng DTI, like the manufacturers and all those who are part of the skeletal or skeleton workforce ng private sector, Sila po ay nabibigyan na po ng accreditation pass ng DTI and other departments, no, and agencies. So sila yung magiging pangunahing gagamit ng rapid pass system natin because nabigyan naman ng accreditation passes yung mga yan. So we will integrate them now into the system para mas mabilis na yung paglabas-pasok nila dun sa checkpoint.
Thank you very much po. The next questions are about the app itself. So aside from the website, can we download it via Google App or the App Store? How else can people access it? Sorry, yeah.
The registration app actually will just give you a link. So all you need to do is go to rapidpass.ph when we launch it on Monday. Kasalukuyang nagte-testing lang kami for quality. But all you need to do is go to rapidpass.ph to apply for a pass if you're an individual. Now, if you belong to a company, your HR of your company can actually fill up a spreadsheet of all its employees na hihingi ng rapid pass. The spreadsheet that is filled up by the HR personnel of the company can forward that to the respective department na mag-approve ng kanilang passes. At from there, diretso na ho yun, connected yung spreadsheet na yun, i-input po namin sa rapid pass system at tuloy-tuloy na yun, yung tinatawag naming bulk registration. Mm-hmm. So that's all you need to do, no? When you get your rapid pass, it will be texted and emailed to you. So parati mong dala sa mobile phone mo yan. And for convenience, we recommend everyone to have to print the rapid pass for vehicles and the rapid pass for individuals. And para din makatulong sa ating mga pulis at sundalo, mas effective po sana kung malagay nyo po sa inyong windows yung rapid pass para matuloy naman yung contactless verification na gusto nating magawa para maprotektahan both the authorized personnel at saka po yung ating mga checkpoint personnel.
Mm-hmm. So another question is, so from the time a person applies till the time it's verified and they get their QR code or their control number, how much time will that approximately take?
If they're already verified and they're submitted to us via spreadsheet, that will be done less than a few hours lang. All we need to do is make sure to validate. And then ang mangyayari niyan ay once the system verifies you, the mobile number associated to your application, either kung galing sa spreadsheet or dun sa form na finalapan mo, that you will then get immediate notification na nakaprocess na in progress na siya. And then shortly thereafter, makakatanggap ka na ng iyong control number via text and iyong rapid pass in PDF format or downloadable format, both in your email and in your text as well.
Mm-mm. Okay, this next question is, magiging mandatory po ba para sa lahat ng frontliners yung pag-secure nitong rapid pass? Or can they still use their IATF or the company IDs?
That's up for the IATF and Sec Lorenzana to decide.
Well, for now, hindi siya mandatory because kakastart lang po natin. Kakastart lang na. So what it will give everyone is an advantage, no? Because if you have a rapid pass system, then you can pass through a rapid pass lane. So mas mabilis na po yung paglusot mo. At hindi ka na maabala. But maybe later on, no, depending on how the IATF will assess the whole system, maybe later on, pag the system is already in place, then maybe we can shift to a mandatory use of the rapid pass. But right now, it's still under yung voluntary, but may advantage. And the distinct advantage is hindi ka na ma-hassle.
Mm-mm.
Yeah.
And ano daw po ang validity? Gaano katagal yung validity nung rapid pass?
Well, right now, it's valid. We're thinking valid up until nandyan pa yung ECQ.
Okay, sir. Ang follow-up,
yeah.
Yes, sir. Opo. So, ang follow-up po dyan, marami rin pong nagtanong. So, ano pong mangyayari pagkatapos nung ECQ? What will happen to the system or the data also that's been collected beyond ECQ po?
Maybe we should...
Asik Mani can say something about the data that will be collected.
Yeah.
Dun sa data privacy on this, there will be a centralized database that will be hosted and managed jointly by DevCon and us. But then yung data na nandun sa device will only be walang anonymized naman siya, Winston, di ba? So it's only for the QR code lang talaga and specific for that cell phone number. And then yung validity, we will erase it after the whole rapid pass is concluded, if ever.
And then Asik Mani, follow-up question po tungkol dun sa data privacy and cybersecurity. May mga nagtatanong din po na how can we make sure na hindi ito maabuso, or ano po ba daw ang mangyayari kung merong nag-try to hack into the system? Ano po yung sagot natin dyan or maipapayo sa mga tao tungkol dyan?
Right now, there's already an initial vulnerability and assessment and penetration test that has been done on the system, and I've asked DevCon and Winston to make sure that all the findings are properly plugged. Continuous yun, ano? It's not a one-time thing. So continuous ang VAPT on the system. We will also have the Cybersecurity Bureau look into the servers. Kumbaga naka-hyper vigilance kami dito sa server that we are actually hosting that we will be monitoring the hosted site ng DevCon. Na nakatutok kami doon. Tututok kami doon.
Okay po. Next question, there are a number of questions related to expenditure. Did the government spend any money for the rapid pass system? Or were there donors? I think it was briefly mentioned, but you might want to reiterate po this point. And if so, if meron pong expenses, how much na po ba yung nagastos dito?
Yeah. Before that, maybe Sec Lorenzana wanted to add to the question on who owns the data and how it's being handled, sir.
About the data, yeah. Thank you, Winston. Can we not share this data to the PNP later on so that for their use, there would be manning checkpoints one way or another in Metro Manila? Maybe if they have those databases, then they can use them for any law enforcement activities that they would like to do or they will do in the future. Pwede no? Pwede no, Manny?
As long as we can cover the data privacy, we observe the data privacy mechanisms. So hand over and make sure na hindi ma-fall into the wrong hands.
Yeah, okay.
Sa ngayon naman, ang data is not just the data, no, but the behavior of people that's consuming the data. Yung ating pong police at sundalo ay really very cautious, no, to make sure na maingat yung paggamit ng data at saka you know, they fit for purpose lang yung kanilang ginagamit. So alam niyo, we were on the field and a lot of our DevCon team was also on field tests. Mahirap talaga yung trabaho ng ating mga checkpoint officers. Mainit, mahaba yung pila, minsan mainit ang ulo ng mga tao. I think this is really helpful and therefore they're appreciating it na yung digital part ay iniingatan nila talaga na mapatupad.
Ang ko lang tungkol sa gastos, ano? So, gaya naman ng pinangako nila Winston, ito ay dinevelop nila, volunteer work na wala silang siningil na kahit ano sa gobyerno. Tapos, yung unang set nga ng mga phones na gagamitin ay binigay ng private sector. Tapos yung mga kakailanganing cost para sa mga email, sa SMS, kasi we anticipate that. Sinagot na namin sa DOST. So I approved a relatively hindi makalakihan 1 million pesos to take care of the communication parts.
Yeah.
Okay.
Labor of love. Pero I wanted lang to say na I think the entire community of DevCon, unang-una, we're more than happy to do the project. No? Pangalawa naman, natututo din naman kami. We're helping not only the government, but we're also improving the skill set of Filipinos. And I wanted lang to amend the description of the community. Unang-una, akala namin mga Pinoy lang kami sa Pilipinas. But there are DevCon volunteers as far back as Ireland, in Europe, meron din sa Japan, meron sa Silicon Valley at sa Seattle. So marami talagang tulong-tulong. In fact, some of our testers galing Malaysia. So I think it's para sa mga geek, it's a good opportunity for us to come together and to apply our passion for innovation dito naman sa problema ng bansa. So from a cost standpoint, more than happy na nakadonate yung oras. Pero natututo din naman kami, gumagaling din kami at napapakita din namin sa ating gobyerno na kaya ng Pinoy yung problema natin isolve.
Thank you very much. And
thank you very much.
Opo. Anything else to add by anyone before I proceed with the next question?
Next question.
May dadagdag lang ako. We want to manage the process kasi will be, even for companies, there's an agency that will be vetting kung halimbawa DTI for supermarkets, so i-check pa nila yung mga human resources that are going to be granted the pass, no? So hindi automatic na pag nag-apply ka, ibibigyan ka ng pass. Mayroong vetting process para lang make sure na hindi siya maabuso, because the objective of the quarantine is for us to stay home, and hindi natin abol na maging 1 million ang kumakalat dyan. Liboy. It defeats the purpose, no? So, just to manage expectations, it's for everybody to apply, but it's a privilege. The pass is a privilege, not a right. Okay.
That said po, are you going to impose any maximum number of passes per company or institution? And then ang follow-up din po doon, how about mga individuals na kailangang mag-apply din, or let's say families, ano po yung limits or parameters for that?
Well, right now, di ba nagbigay na ng accreditation passes ang DTI. So that's based on the skeleton or skeletal workforce na sinabit ng iba't ibang mga companies. That's number one. Then sa PCOO, nag-submit na rin sila ng mga media, yung mga media workers natin already submitted a list to PCO and they've been given accreditation. So sila muna. Yung mga health workers, wala naman, unimpeded naman ang health workers natin. We don't require them to get the rapid pass because all health workers dapat tuloy-tuloy ang travel nila. So ganon. So we're still maintaining the skeleton workforce. Dun sa siguro yung tanong yun sa families, maybe the question is basically on those per family, di ba? May isang member of the family who is allowed to go out of the homes to purchase groceries and essentials. Wala pa tayo sa level na yun. Maybe in the future, we will be able to go to that level. So, natin, next phase. But wala pa tayo sa phase na yan. We're still in the phase na we're giving rapid pass to those who pass through the checkpoints pa lang.
Do we have yes po.
Kasi may mga nagte-text sa akin dahil mahihina ang kanilang wifi. So yung isang tanong, ilan ba yung total checkpoints sa NCR at ilan yung pwede natin gamitan ng rapid pass sa unang implementation natin next week?
Thank you po, Secboy.
We have 200 cell phones that were donated to us, so that would be given to ilan yan, Winston? 2 cell phones per checkpoint, no? Ganun ba yun?
Per checkpoint. So we have a total of 56 checkpoints in
56
NCR, no?
points,
Or
yeah.
Metro Manila. And of the 56, meron tayong na-identify na 6 very high volume checkpoints. At doon po namin uunahin kasi that's where our critical services and vehicles are spending too much time, no? And also endangering our frontliners. So yun yung priority, no? Yung 6 critical areas where we have congestion. And then we will incrementally disseminate the rest of the phones. Pag natapos na po yung aming deployment training and planning with the Joint Task Force and with PNP and the AFP.
Winston?
Actually,
Sir.
I was about to suggest that na unahin muna yung mga heavy traffic na checkpoint.
Pwede na po bang banggitin kung
Yes, sir.
alin pong mga areas na to, yung 6 critical areas po?
Yeah, sandali na. Let's just answer
Okay.
Sec
Yes po.
Lorenzana.
Can
Yes,
we also use other phones other than Samsung 18?
Opo, sir. The design released for us to use any phones. Lang po, kasi bago lang po yung sistema, gusto nating maniguro na tayo bug free, no? Kasi yun ang iniingatan ng team. Yung aming quality team is very strict. Kaya medyo subukan muna natin with controlled number of phones and then we will expand it. We will expand it later on. Sorry, Nice. Go ahead, please.
So yung follow-up question dun sa critical areas, pwede na bang banggitin kung alin itong mga areas na to? Tsaka meron ba tayong estimate ng volume nung tao na dadaan doon or na potentially pwedeng ma-transfer dun sa rapid pass system in those areas?
Nag-aantay pa tayo ng go signal, no, from our clients, which is DILG and DND, to give us the marching order kung ano yung uunahin at saka paano iti-train yung staff, no. What we've noticed, one of the areas that's really needing this is the Marikina Marcos Highway checkpoint. Doon po namin sinubukan yung ating high volume testing, no, and we really see na kung mapaayos natin yun, mapapabilis yung daloy ng especially the motorbike frontliners, yung nagdadala ng pagkain at nagde-deliver. Kasama din doon yung mga vehicles from the north. So we're awaiting signal lang from both Sec Lorenzana and Sec Anyo kung saan po kami magsisimula and we start training the personnel on the checkpoints. We did identify yung 56 and so far yung 200 phones na meron tayo, kasya pa naman siya to ensure that we have enough devices at the checkpoints.
Okay. Follow up din ulit dun sa mga areas na yun. So will the rapid pass holders still be required to undergo thermal checks at the checkpoints or exempted na ba sila?
Yeah. Hindi yun nagbibigay ng temperature ang rapid pass. We're hoping to build that technology soon. Pero I think Secboy has something under his sleeves again. Marami kasing maraming idea si Secboy, no. So I think in connection with potentially a walkthrough or a drive-by thermal scanner, mapapadali din yung rapid pass. So baka pwede mong suotin sa shoulder mo yung rapid pass mo habang naka-thermal scan ka at isang pass ka na lang. So we're hoping for that as well.
Ninya?
Yes po.
Yung ating ine-explore na possibility, actually may nag-develop ng sistema ng pag-determine in a group kung sino yung above the prescribed temperature. Kung halimbawa isang grupo ng mga tao, actually original nilang ginawa from a drone, makikita nila kung sino-sino doon ang above the required allowable maximum temperature. Kaya mapipinpoint kung sino doon. Ngayon, kung wala, wala. Lahat na yun ay clear. Pero siyempre, hindi naman practical na mag-drone tayo ngayon. Kaya baka gagamit muna ng mga pwedeng nasa itaas yung instrumento na habang dumadaan yung grupo, makikita doon kung sino ang mataas ang temperatura. So ibang grupo naman ang umaaral nito. Hindi ko muna ihahayag hanggang hindi maayos. So isa yun sa isang bang mga teknolohiya. Anyway, natutuwa po ako dahil nandito si Secretary Del Lorenzana, dahil kahit wala si Sec Galvez ay alam ko namang siya nagbibigay ng mga instruction doon, dahil itong deployment details ay kailangan matress out na bago mag-Lunes. So kung merong mai-assign si Sec Galvez para naman doon sa deployment details. Salamat po.
We will.
So related lang po dun sa deployment, and the target nga po is Monday, handa na daw po ba yung system sakaling merong massive inflow ng mga applications?
Magiging handa sa Lunes. The software is largely done, no? So I think a lot of the work now, ito yung ating mga masisipag na developer volunteers from our local startups, yung si Secuna for security and si QE 360 sa ating quality. Ito po yung mga volunteers natin. They're working really hard to make sure that the system is fit for use, both in security and also in scale. So we look like we'll be there on Monday. So nakahanda na po. Sinusubukan po namin lahat ng mga sistema, at saka alam mo, naghahanap ng deadline parati mga geeks, di ba? So maganda na may deadline kami. Pero we're confident that it should be ready on Monday. Mayroon din naman kaming mga safeguards na in case kailangan po ng other things. No? I also want to mention that Microsoft actually donated the infrastructure for this. No, it's Microsoft Azure cloud system where our platform is installed. At si Microsoft naman ay nagko-commit din na if we needed more capacity, they will provide as needed. So we're also tightly partnering with Microsoft para naman in case na dumami at nagsabay-sabay yung applications, we can process it.
Okay. Thank you. The next batch of questions are about the data again. So balik tayo dun sa data. Ano-anong klaseng data po ba yung ginagather during the sign-up process? And then yung follow-up doon is, will the data of rapid pass holders be used in the government's national ID program? And ano po ba yung mga safety nets, again, regarding privacy?
Who wants to catch this?
I think iba yung kinukuha sa national ID kasi ito eh. This is just for temporary use during this crisis. Siguro pangalan, address lang yan eh. Tsaka cellphone. Very basic information siguro. So that you can counter-check the name with the ID that the person will present. So paano makilala? Hindi ito siguro very baka naman, hindi naman siguro tatanungin dito ko yung date of birth, ano? Ano, Winston?
Wala po. This is the ID is intended really to support frontliners. So kung
frontliners lang.
Kailangan mong lumabas dahil kailangan ka sa ating state of calamity with this pandemic, that's the intention. No? Kaya piniprint namin itong dalawang ID na to, para sa kotse at para sa tao. So ang purpose naman ito at ang data contract between the government agency and the provider of information ay para lamang to support their mission as a frontliner. So yun po yung use of data natin. No? And what we collect is your basic name. Kailangan namin yung address para malaman namin kung saan ka manggagaling. Kailangan din namin yung destination para malalaman namin kung ilang checkpoints yung kailangan mong daanan. At yung mobile phone mo para ma-notify ka namin.
Correct.
Kung ano na yung status ng iyong pass. So we're only capturing what we need to capture and nothing more. And then pangalawa naman, yung napapasa naman sa checkpoint ay pangalan lang at control number. So hindi siya nagko-constitute na tinatawag na PII or personally identifiable information. So dumaan na po kami sa sa checkpoint na DICT si ASEC Manny para naman masiguro ang ating data privacy, at nag-consult na rin po kami sa ating Data Privacy Commission para paano na gamitin yung ating mga data.
Okay. Ito naman po yung questions regarding sa fake QR codes. Paano po ba mape-prevent yung mga resourceful dyan na pwedeng gumawa
ng sariling
QR codes?
Sariling QR codes.
Kapag merong fake QR code na sinubukang gamitin sa checkpoint, ano daw po ang mangyayari?
Nako, pala na si Secretary Lorenzana niyan. First of all, the system is not completely tamper-free. No? Nothing is. And hindi natin ginawa siyang ganyan. So, that's a possibility. Pero mahirap siyang gawin, number one. Pangalawa, we really want to make sure the system is inclusive. So, kasama doon yung non-QR code, right? Control number passage. So, hindi siya ganun kakomplikado. However, the system has an analytics backend, and the system has anti-fraud and big data ML, machine learning. So malalaman natin if the pass is being abused, number one. Pangalawa naman, the personnel at the checkpoint can and may still ask for your ID. Kasi ang pass naman is really to tell you na pwede kang dumaan. It's not a definitive identity of who you are. So, pwede pa rin mahingi yung ID mo, pero ang ina-avoid natin yung permit, yung mga papel, yung mga maraming dala-dala ng ating mga critical vehicles. Kasi not only is it inconvenient and long, it's also a potential transmission mechanism for what we're trying to avoid. Kaya inaalagaan din natin yung ating mga checkpoint personnel. No? So, it's not tamper-proof, pero I don't advise anyone to try. Kasi we definitely have mechanisms to figure out, at sana naman ating law enforcement din will be acutely aware. Magaling naman yung ating mga enforcement eh. Maamoy ka nila kung hindi ka truthful when you pass. Take money.
Winston, just like to add, no, this is not an ID system. This is the permit. This is a pass. You still need an ID kung tatanungin, ikaw ba nga ba to? So yun dun sa data privacy, it doesn't at all, it's not even coming close to becoming a digital identity of sort. It's really just the pass. Pwede ka bang pumasok o hindi?
Permit. It's a permit.
Permit. So kung hihingan kang ID, syempre paabot mo kasi pulis yan eh. Diba? Permit ito. Ang hinihingi mo dito is yung permisong makapasok o hindi. Thank you.
Ano pa?
Thank you.
Question pa ba?
Actually, marami pa po. So, ang isa pang tanong is, pag natapos na yung ECQ and mas makakagalaw na yung mga tao, meron pa bang mga potential uses yung rapid pass?
Maraming assignment si Capsec.
Maghanap tayo. Saan gagamitin?
Actually, isa sa mga gusto rin namin tingnan is yung movement, no? So the rapid pass system also allows us to study yung movements in and out. So that helps us sa policy. As policy makers, makikita natin yung, for instance, yung time, kung kailan sila pumapasok, makikita natin saan nagkakaroon ng bottlenecks, if ever. So these things can also help us in studying policy decisions na pwede na natin gawin. And then like I said, hopefully in the future, we can also use this down the line, down to the barangay level. No? If we want to be ambitious, yun din isang ambition namin. Yung sinasabi nga na per family per family may isang designated lang. So if may isang designated lang, then we can also use the rapid pass dun sa sistema na yon. No, if we wanna try to do that, that's in the next phase. We just have to perfect this phase muna. But later on, down to the barangay level, makokontrol na rin. Kasi it's actually the same concern eh. We want to make sure na yung mga tanods, mga barangay tanods and mga barangay enforcers natin are also protected from transmission. So maybe down the line, down to the barangay, down to the LGU level, makaka-deploy din tayo ng ganitong klaseng sistema para to make sure na yung lumalabas talaga ng bahay ay yung talagang
authorized.
Yeah.
But of course, the assumption is kailangan mabilis din po yung pag-deploy ng phase 2. Tsaka depende rin po dun sa haba nung ECQ.
Yes. Of course, it depends on all of that. That's why I said phase 2 yan. So it also depends on what's gonna happen. Kasi even if we say magta-transition tayo to a new normal, that will also help us no, sa new normal. Kung sabihin natin, ilan lang ang industries or manufacturing companies ang pwede mag-operate kasi we don't want a surge na naman in transmission, then that helps us manage the system as well. So malaking tulong talaga ito because from a management perspective, we want to be able to see movement and control movements. Kasi basically, fighting the COVID-19 virus is actually controlling yung movements ng tao para magkakaroon pa rin ng social distancing. Diba? So it gives us policymakers a tool really to be able to enhance yung social distancing na kinakailangan natin habang wala pa itong vaccine.
Okay po. We're down to our last couple of questions na related to this. Magpapaumanhin po ako dun sa mga media na may mga tinatanong na hindi related dun sa rapid pass. Siguro po sa ibang press conference na lang po yun para we can stay on topic. So paano po daw halimbawa nawala ng signal dun sa checkpoints or the checkpoint personnel are not able to access data or Wi-Fi, what happens then?
So we actually make sure that that's not the case, no? Kaya ang ginawa namin sa ngayon, you have to get your rapid pass before that one day before you have to use the checkpoint. Ang importante po niyan, it gives us at least one day, no? Gives us the chance to approve you, and it also gives us the chance to download the approvals to the phone of our checkpoint personnel. Ang importante ho ng pag-download ng approvals, itong sinasabi namin ni Manny kanina na just your name and your control number, kasi pag pupunta na po sa checkpoint yung ating checkpoint officers, nasa telepono na nila yung lahat ng approved. So hindi na kailangan ng internet at hindi na kailangan ng Wi-Fi. So this gives us the field level resiliency of our system. So kahit walang Wi-Fi, kahit walang signal, basta sa umaga, bago sila pumunta sa checkpoint, mag-download sila, aandar po yung system.
Okay, so ang paalala natin sa publiko na gagamit ito, dapat at least a day before, or you were just mentioning the morning before, basta hindi pwedeng ura-urada yung pag-apply sa rapid pass. Yun ba yun? So,
hindi pass lang.
Yep. May enough leeway. Okay, and then one last, so for those who don't have regular access to Wi-Fi or data, meron bang designated places kung saan sila pwedeng makakonect sa free Wi-Fi para makapag-download and set up or apply?
Yeah. Ako, nawala tuloy si Asik Manny sa DICT.
Kahit voice na
Marami naman po. Ayan, bumalik na, sir.
Sorry. Ano nga ulit, Nins? Sorry, Nins.
Saan sila makakahanap ng free Wi-Fi?
Okay. The systems can be...
Yung applicant po, sir.
Yung applicant. Well, una sa lahat, what we want to encourage nga is at least for the companies to also enroll their employees. So yun muna. Kasi mass enrollment naman. Mag-apply ka man, kung wala ka rin kasiguraduhan na may magbe-vet sa'yo, magva-vouch para sa iyong permit, it might not get approved anyway. So ang atin dito is the convenience might not necessarily be that you have to have the internet. But I think naman, Winston, the system can be accessed even with a very slow internet kasi sa web lang naman, di ba? So, yeah. And then kung hindi mo matanggap yung image, hindi mo ma-print, dahil wala kang printer, pwede nga ding SMS matatanggap mo. Ibibigay mo yung number mo, and then sa'yo, SMS code ay ano lang muna, text code lang. Pero kung may printer ka, or kung maganda yung phone mo, madadownload mo yung QR code, magaan lang yun. Dadating yun sa'yo at dadating. The image is...
Para labanan ang banta ng COVID-19 sa ating bansa, mahalaga ang kooperasyon ng bawat isa. Ang pananatili sa loob ng bahay ay isa sa pinakasimple pero pinaka-epektibong paraan para hindi kumalat ang virus. Kunwari, ikaw ang tuldok na ito. Malusog ka at malakas. Lumabas ka ng bahay. Ang hindi mo alam, may nakasalamuha ka ng may COVID-19. Tandaan, mahirap malaman kung sino ang may virus, pero madali itong maipasa sa iba. Pwedeng naipasa na pala niya ang virus sa iyo nung umubo siya, o bumahin. O baka naman ay nahawa na dahil humawa kayo sa parehong bagay na kontaminado. Ngayon ay mayroon ka na ring COVID-19. Isa ka ng carrier na makakahawa sa iba. Dahil maaaring ilang araw pa bago lumitaw ang sintomas na ubo, sipon, hirap sa paghinga at lagnat. Pwede ring wala kang nararamdamang sintomas, ngunit nakakahawa ka pa rin. Pag-uwi mo sa bahay, maaari mong mahawahan ang iyong pamilya. Kasama na rito ang lolo at lola mo o ang mga magulang mo na may edad. Sila ang may pinakamahina na depensa laban sa virus. Ang mga may sakit sa puso, diabetes, high blood, at iba pang pre-existing conditions at mga buntis, mahina ang panlaban sa COVID-19. Kapag na-infect ang taong mahina ang immune system, posibleng magkaroon siya ng malalang karamdaman at kailanganing dalhin sa ospital. Sa patuloy na paglabas ng bahay at pagpunta sa pampublikong lugar, tinatayang maaari kang makahawa ng 3 pang tao at sila makakahawa ng mas marami pang iba. 20% ng mga nahawa ay maaaring maospital at dadami ng dadami ito habang mas kumakalat pa ang virus. Bukod sa dumaraming COVID-19 patients, marami pang ibang may sakit ang nasa mga pagamutan. Ang mga pasyenteng malubhang-malubha na ang karamdaman, hindi na maaasikaso. Wala ring lugar para sa mga pasyenteng may ibang karamdaman. Kaya nating iwasan ang patuloy na pagkalat ng COVID-19 kung iisipin natin ang kapakanan ng iba. Kailangan nating isipin at kumilos na parang bitbit na natin ang virus para hindi ito kumalat pa sa iba. Sundin ang social distancing. At hanggat maaari, manatili sa loob ng bahay. Kung talagang kinakailangang lumabas, panatilihin ang 1 metrong layo sa ibang tao. Maging malinis din sa katawan at sa kapaligiran. Parating maghugas ng kamay gamit ang sabon at tubig. At i-disinfect ang mga bagay na madalas hinahawakan. Ang mahalaga, mapabagal natin ang pagkalat ng COVID-19 para mas kakaunti ang mga kailangang magpa-ospital at mabawasan ang mga Pilipinong magkakasakit. Magiging epektibo lamang ito kung mananatili tayo sa bahay. Sundin ang social distancing. Isang maliit na sakripisyo para sa buhay ng kapwa nating Pilipino. Tulong-tulong tayo. Let's beat COVID-19.
Magandang hapon po sa inyong lahat. Ako po si Dr. Bev Ho mula sa Department of Health. Ako po ang makakasama niyo ngayon sa ating Beat COVID-19 Virtual Presser. Kamusta na po kayo? Nasa ikatlong linggo na po tayo ng Enhanced Community Quarantine or ECQ dito sa Luzon, habang ang ating mga kababayan naman sa Visayas at Mindanao ay aktibong nilalabanan ang pagkalat ng COVID sa kanilang lugar. Nagpapasalamat po kami sa inyong lahat sa pagtugon nyo sa aming panawagan to stay home, practice physical distancing, at regular hand washing with soap and water. The COVID-19 virus is novel. This means it's new. And we as a country are learning every day how to deal with it. Marami pa tayong hindi alam tungkol sa virus na ito. But we adjust our strategy according to our learning progress. Like many things we encountered, we look to science for guidance to lower our uncertainty. Kinakailangan natin ng siyensya upang malaman kung ano-anong mga steps ang dapat nating gawin at para masugpo natin ang ating kalaban. In this case, it's COVID-19 virus. Siyensya ang nagbibigay sa atin ng evidence to implement guidelines that will help us protect ourselves from infection and treat those who get sick. Pag mas marami tayong ebidensya, mas malakas ang ating maging case or basis para gumawa ng intervention. Tutok lang po tayo. We are in touch with the leaders of Philippine medicine, epidemiology, and public health. Nandiyan na din yung mga mathematicians, engineers, at economists. Together, we are one community working to make sense of new information coming to us every day and assess whether solutions are applicable in the local setting. Ano ang mga alam natin ngayon? First, we will see more cases because we will conduct more tests. The number of confirmed cases will continue to rise in the next few days as we are able to test more people. Ngunit, hindi po natin ito dapat ikabahala. Mas gusto po natin na ma-confirm ng maaga ang mga positive cases upang matuunan sila agad ng atensyon at maiwas ang pagkalat ng COVID-19. Sa tanong na flatten na ba natin ang curve, patuloy na po natin pinag-iigting ng DOH ang pag-gather at pag-encode ng mga datos upang magkaroon tayo ng mas kumpletong picture. Ang ating mga ospital at health facilities ay nag-assign na po ngayon ng data encoder para real-time nilang maisubmit sa atin ang mga datos at maaga natin ma-confirm ang mga cases. Malinaw po sa atin ngayon na hindi pa po bumababa ang kaso ng COVID-19. Second, we must get used to a different kind of normal habang wala pa pong nadidiskubreng vaccine or bakuna laban sa COVID-19. At habang wala pa ring immunity ang sambayanang Pilipino. Sa ngayon po, meron pong bakuna laban sa ibang uri ng viral infection gaya ng measles or tigdas. Pero wala pa po para sa COVID-19. At hindi pa po natin nakikita ang posibilidad na ito in the next 3 months. Kaya ang best weapon po natin ngayon ay ang preventive measures natin. We are hoping that itong mga good habits na to ay maging second nature na sa atin. Third, prevention is better than cure. Alam na natin tong lahat. Malaki po ang inyong papel upang mapigilan ang pagkalat ng COVID-19. All of the existing evidence now point to proper hygiene at physical distancing bilang dalawang paraan para maiwasan ang paghawa-hawa. Kaya kami makulit. Ito ang palagiang paghugas ng kamay gamit ng sabon at tubig at tamang pag-ubo. Sa panahong ito, mahalaga din na ipagpatuloy ang iba pang public health prevention measures. Bukas ang ating mga health centers, kaya tuloy lang dapat ang pagbabakuna ng inyong mga bata. Panatilihing malinis ang bahay at kapaligiran para maiwasan din ang ibang sakit tulad ng dengue. Keep yourself well, active and healthy. Kumain ng tama, mag-exercise at siguraduhin ikaw ay tumatayo every 3 hours kung nakaupo ka lang sa bahay. Ang inyong resistensya ay mahalaga upang hindi kayo maging vulnerable sa COVID-19. Kung lalabas naman po kayo, mabuti rin na gumamit kayo ng mask, kahit ito po ay cloth mask. Pero para po sa mga nag-aalaga ng mga immunocompromised, ang aming rekomendasyon ay gumamit pa rin ng surgical mask. Palagi rin po natin ipinapaalala ang physical distancing. Siguro sa lahat, ito yung pinakamahirap na sundin natin. Sa mga pag-aaral, may itinatawag na imperfect distancing because of many reasons. Para sa ating mga Pilipino, ito ay posibleng cultural or pwede ring dahil sa socio-economic factors. Likas sa ating mga Pilipino ang pagiging close or malapit sa isa't isa, lalo na sa ating mga pamilya. Dahil dito, hindi tayo sanay na magkakahiwalay. Sa LRT nga, dahil dikit-dikit, parang nagkakaamuyan na yung mga commuters. Sa palengke at grocery, dikit-dikit pa rin ang mga taong namimili. Gustuhin man natin ang space, in reality, mahirap talaga ito. Lalo na sa mga communities kung saan magkakatabi ang bahay at masisikip ang kalsada. Kaya naman, nagtatayo tayo ng mga community quarantine facilities para maging mas effective ang ating physical distancing at isolation. Ang mga pasilidad na ito ay para sa mga PUI, PUM at kanilang mga pamilya, lalo na sa mga patients or cases na walang sariling silid kung saan sila pwede mag-quarantine. Naintindihan po namin na ito ay isang malaking sakripisyo, pero worth it naman ito dahil kalusugan naman natin ang nakataya at kalusugan ng mga mahal natin sa buhay. Para po naman sa mga iba nating updates ngayong araw, currently, we have RITM as our National Reference Laboratory, and we have 7 sub-national laboratories at full-scale implementation. With 40 other laboratories in the pipeline, we can expect our daily testing capacity to increase significantly within the next couple of weeks as more laboratories will be certified. Nais lamang po din naming linawin, strategic po ang direksyon natin sa testing. Ibig sabihin, bagamat ito ay pinalawak, targeted po ang testing natin to cover those who are in need. Hindi natin layunin na pipila tayong lahat, isang araw, at basta-basta na lang pong magpapatest. Yes, we will test, and test, but sabi din ng WHO, test the suspected cases or those who need it, and not every single one of us. Gaya rin po ng sinabi ni Secretary Galvez, ang ating Chief Implementer ng National Task Force on COVID-19, ang mass testing po na ito ay pagpapasiguro na maitest lahat ng PUIs at ang ating vulnerable populations, lalo na ang ating mga healthcare workers. Ito po yung sinasabi nating mass testing. Mas madaming mabibigyan ng test, lalo na ang mga may kailangan talaga nito. What we can assure you is that DOH has been working to cover those who are in need of testing. Iba pa pong mga updates natin, upang makapagbigay ng patuloy na serbisyo sa ating mga kababayan, inilunsad ng ating Lung Center of the Philippines ang kanilang Ask Force. This is an online consultation platform for COVID-19 through their Facebook page. Ang Philippine General Hospital naman po ay naglunsad ng isang dedicated 24-hour telemedicine hotline, 155-200, in cooperation with PLDT. Ulitin po natin, 155-200. Bukas po ang hotline na to 24 oras. Kung kayo po ay mayroong sintomas o iba pang katanungan about COVID-19, you can dial this number for consultations with medical professionals. You can also use this hotline para makapag-donate po kayo ng PPE or iba pang supplies. Ang telemedicine ay nakakatulong sa ating publiko para maka-access ng impormasyon mula sa medical professionals, para matugunan ang inyong mga kinakailangan. Ito ay makakatulong din para yung mga hindi po kailangan pumunta sa ospital, hindi na po kailangan unduly ma-expose. Upang masiguro naman ang ating kaligtasan, patuloy po ang ating pamahalaan sa pagtatayo at pagko-convert ng existing large-scale structures as COVID-19 quarantine facilities. With this, the Department of Health would like to thank the Philippine Sports Commission or PSC for offering Rizal Memorial Coliseum and other facilities to be used as quarantine sites for our COVID-19 patients. Isa ang Rizal Memorial Coliseum sa mga unang inoffer ng PSC para magamit bilang quarantine sites, kabilang na ang Rizal Memorial Sports Complex, Ninoy Aquino Stadium, and Rizal Memorial Baseball Stadium. Sa tulong ng Department of Public Works and Highways, ginawa na po ang pag-convert ng mga nasabing sports facility na magkakaroon ng tinatayang 120-bed capacity or 120 cubicles para sa mga pasyente. This Monday, April 6, RMC will begin to accept mild and asymptomatic COVID-19 positive cases from Metro Manila and nearby areas. This will be operationalized by the Armed Forces of the Philippines, the Philippine National Police Medical Corps, with 3 doctors, 5 to 10 nurses, and 20 medics. Pinapasalamatan rin po ng DOH ang ating private sector partners for their contribution to the construction of our community quarantine facilities. Primed BMD, Bloomberry Cultural Foundation, EEI Corporation, Vista Land, Ayala Land, AC Energy, Makati Development Corporation, Philinvest, ICCP, Aboitiz, World Trade Center Metro Manila, Lina Group of Companies, Meralco, PLDT Smart, Globe, DMCI at Concepcion Industrial Corporation. Pinasasalamatan din po namin ang mga private health facilities na patuloy na nakikiambag sa ating laban kontra COVID-19. Katulad ng Fedel Mundo Medical Center located at Banawe Street, Quezon City na simula rin Lunes, April 6, magsisilbing isa sa mga exclusive COVID-accepting hospitals natin sa Metro Manila. For our case updates po, April 4 as of 4 p.m., today, April 3 as of 4 p.m., meron po tayong 385 new cases ng COVID-19 positive patients. Ang total po ng COVID-19 positive patients natin ngayon ay nasa 3,018. Nakapagtala rin po tayo ng isang karagdagang pasyente na nakarecover mula sa COVID-19. Meron na po tayong total of 52 recoveries as of today. Subalit, 29 po sa ating mga kababayan ang naitalang pumanaw dahil sa COVID-19. Atin pong gustong linawin na kaya mataas ang number of deaths sa araw na ito ay dahil ito ay kombinasyon ng number of deaths mula nung isang araw at yung mga new reported deaths. To date, we have 136 COVID-related deaths. Sa ngalan po ng Department of Health, kami po ay taus-pusong nakikiramay sa mga pamilya ng mga naulila. Para po sa details tungkol sa mga bagong kaso ng COVID-19 sa bansa, i-access nyo po ang www.ncovtracker.doh.gov.ph. Ito po ang ating live COVID-19 case tracker. Continuous din po ang pagsasagawa ng contact tracing kung saan aktibo nating hinahanap ang mga positibong infected sa COVID-19. So our goal is to minimize our cases to zero as soon as possible. That's why we need your help and cooperation. Makaambag po tayo laban sa pandemic na to sa pamamagitan ng hindi paglabas ng bahay, pag-practice ng physical distancing at palaging paghugas ng kamay. So, para naman po sa mga tanong ng ating media partners at ang ating mga callers, number 1, galing kay Mariben Verganio Epa Lopez sa Facebook, would it be possible to allocate designated places in the respective barangays for people considered as PUM and PUI? This way, we can have them taken care of and guarded so that the strict quarantine will be followed. Ang kasagutan po natin dyan is our local government units have already initiatives related to this. And the national government has also stepped in. Kaya naman, we have conversion of these various big facilities from basketball courts in the barangay to even the convention centers as community quarantine and isolation facilities. Yung DOH po ang nag-i-issue ng standards which are in line with infection prevention and control practices. Galing naman po kay Alison Makasait, ano po ang magiging basihan ng DOH para i-quarantine ang mga mild cases sa mga national quarantine facilities? Lahat po ba ng magpapakita ng mild symptoms ay i-quarantine or selected mild cases lang? So binabase po natin ang sagutan sa katanungan na ito dahil sa ating mga algorithm, no? So mild cases which are not eligible for admission into hospital, yung mga non-elderly, mga no comorbidities, non-pregnant cases, dito po sila ma-admit. The quarantine facilities are in place because we understand that it's not easy for many households to isolate themselves from one family member due to space limitations. Galing naman po kay Caroline Bongkin ng CNN, can our laboratories do a total of 3,000 tests a day by around April 14. We are confident that our laboratories can do a total of 3,000 tests a day by April 14. No? RITM is now processing around 1,000 tests per day. Inaasahan po natin na mas tataas pa ito hanggang 2,000 tests per day sa mga darating na araw. Meron din po tayong mga subnational laboratories, yung nasabi ko na kanina, na nagproproseso ngayon ng halos 500 tests per day. Patuloy din pong itataas dahil may mga tinitrain po ng mga bagong medtech para dumami ang shift sa ating mga subnational laboratories. The test kits produced by UP is also expected to get marketing authorization as soon as they submit their results to FDA. Kapag ito po ay naaprubahan, ito po ay karagdagang dagdag sa number of tests. Nais lamang din po naming linawin, ang target po natin itest ay yung symptomatic patients and obviously our healthcare workers. Ang ating expected capacity by the end of April ay at least 8,000 tests per day. At we are very fervent in our commitment to make sure that happens po. From Christine Sabilio, ABS-CBN Online, there have been some cases of PUIs dying in tents and not being accommodated by hospitals. What is being done to make sure they are given proper care? So may referral network po tayong sinusundan para hindi mapabayaan ang kahit sinong pasyente. Sa kasalukuyan, the COVID-19 referral hospitals are expected to receive the severe cases which will require critical care. Non-COVID-19 referral hospitals are expected to receive those mild cases and even those non-COVID patients. No? Hindi natin dapat kalimutan na sa panahong ito, hindi lang naman COVID ang sakit ng mga Pilipino. From Greg Gregorio, how many patients from Philippines will be included as we participate in WHO Solidarity Trial? How is the process for this and is there a waiver that needs to be signed? So walang limit po kung ilang pasyente ang maaaring sumali sa Solidarity Trial ng WHO. Ito ay yung malawakang research para ma-document kung anong gamot ang epektibo laban sa COVID-19. So nag-submit na po ang ating mga eksperto ng kanilang proposal. Initially, we have 20 hospitals who are participating. Ang ibig pong sabihin nito, kung may COVID-19 patients sila, ang kanilang doktor ay maaari silang i-enroll sa trial na ito. So may isang system po na magdedesisyon kung alin sa 5 treatment protocols ang ma-apply para dun sa pasyente. Kaya po siya randomized. At syempre, bawal i-enroll ang mga pasyente na mayroong contraindication dun sa mga gamot dun sa treatment protocol. At ang pinaka-importante po sa lahat na dapat natin i-highlight dito is the informed consent that will be sought from the patients or their legal representatives. It means that the doctors need to explain fully to the patient what the trial is about, that the tests are going to be randomized, and they have to agree to joining it. So, salamat po sa mga nagpadala ng mga questions. Hanggang dito na lang po muna ang masasagot natin ngayong araw. Para sa mga ibang katanungan nyo, bukas na lang po siya. So, to close today's virtual presser, the rate at which cases increase in the country depend on every one of us. COVID-19 needs to stop at your doorstep. Kayo ang frontliner sa laban na to. The health system is our second line of defense. The rate at which cases recover depend on the health system, but the number of cases depends on how well you and I can prevent new infections. There are two fronts into this war: your homes and the community, and the hospitals. We have more than 1,000 hospitals in the country, but we have 20 million homes or households. We will have a better chance of winning this when 20 million homes or households will do their part. So tanungin natin yung sarili natin ngayon, are we doing everything we can to prevent COVID-19? So lastly, we remind everyone po to please fact-check. Tumingin lamang po tayo sa verified and legitimate information. Fake news gives us unnecessary panic and anxiety, and it's not the right time for this. Di natin kailangan ng panic. Lalong humihirap ang laban kung may fake news. Sabi nga ni Yusek Vergere, buhay at kaligtasan ang nakasalalay sa bawat click and share natin sa social media. For more information and updates, you can check our social media accounts po, and please do join our DOH Viber community. We'll keep you posted. Stay tuned po for our Beat COVID-19 virtual presser tomorrow. Mag-ingat po tayong lahat. Sana po nasa mabuti kayong kalagayan, and tandaan, together we can beat COVID-19. Maraming salamat po.